Good to see you all. My name is Tami, and I'm the new CEO here at Q Factor. We're very excited about our opportunities to help build the future of the radio industry, of course, with industry being right in the heart of it. I want to make sure I acknowledge two of our leadership at Q Factor, the co-founders. First, Alan Winkler. Stand up. And our board chairman and co-founder, Jason Winkler. They really have vision behind this amazing space industry, which is home to companies from 1 employee to 50,000 square feet. And we really believe that that's an important part of creating and building cities. It's this innovation ecosystem. That's why we're so excited today to be here, to be part of this big announcement. I also want to acknowledge our incredible partners at Catalyst, our equity partners. I know I see a few of you. If you guys wouldn't mind just raising your hand and giving a wave. There we go. Thank you. So, as we kick off today, I talked a little bit about how important innovation is to what we do as industry and what we do here in this space. So if you're not familiar with what we do here, please catch one of our colleagues. They'll be happy to show you around and talk more about how we build communities and how we build companies. Now, we talked a little bit about innovation in terms of the ecosystem, but I also want to say why this is so important to us today in terms of health sciences. Because in phase 2 of our development here, we have nearly 100% of that space completely committed to recursion and Denali, and we're really excited to have them here as partners as well. But let's get down to the business of why we're here. It's my pleasure to introduce you to Mayor Mendenhall, who will have the opportunity to share this great vision for the future of health sciences in our community.
Woo! We're here today to celebrate Salt Lake City's leadership around healthcare innovation in particular, which is an entire umbrella of relationship, technology, and innovation in and of itself. But most of all, you, our partners, and the release of our healthcare innovation blueprint. I gotta give a shout out to somebody most of you probably know well, and if you do, you know that he's really the brains behind a lot of when I say Tech Lake City, he makes it happen. Clark Cahoon. It was just about 2 years ago, around this time of year, that I gave my first State of the City address. And just a few things have happened since January of 2020. But one of the big things I talked about was doing Tech Lake City. And I think a lot of people, especially in our administration, when I started saying those words, even before I brought you on, Clark, we're saying, oh my gosh, what is the mayor talking about? How are we going to build Tech Lake City? What does that even mean? But the beauty of it is that you are already here in a large way. Healthcare innovation, digital technology, and all that is in this, the family, so to speak, of the industry, already has deep roots in Salt Lake City. Much of which coming from the University of Utah are great partners who thankfully are expanding and growing into Salt Lake City even more. But you, the entrepreneurs, the innovators, the employers, the people who are investing in the city in the future really just needed some, in my opinion, amplification and support by your city. That's what the Healthcare Innovation Blueprint, guided by the University of Utah's Gardner Policy Institute, who helped the city bring it together, but really informed by an incredible diverse group of stakeholders from industry, academia, law, community organizations, and existing tech companies saying, how exactly do we get there? Now that we have the Healthcare Innovation Blueprint that we're finally releasing and celebrating today, this is how we take those shared values and we put them into action. This is how your capital city is going to link arm in arm with you and with the innovators of the future to make sure that Tech Lake City not only, and I think visually, so we're talking about economic development from a completely different perspective than the city has done in the past. This blueprint's going to help us get there. But it's also, in this other square, going to connect our residents, many of whom, through decades, even generations of systemic separation from the advantages that many of us enjoy, are about to connect to this industry because of our intention and our work together in the Healthcare Innovation Blueprint. And then absolutely equal to, and in many ways even greater, are the public health benefits that we can't even begin to dream of how far they will reach and how long they will go. But this is building these public health benefits the world over. And I'm so thrilled, I'm so excited that you said yes when Salt Lake City said we want to build the plans to get there, we want to build it with you and then execute it with you. Thank you for seeing the vision across the spectrum and know that Salt Lake City is passionately committed to innovating with you, whether that's our zoning, our financial opportunities to help, our ability to connect and amplify what you're already doing to the employees and the workforce that you need, and to create fertile ground for the next entrepreneurs and innovators of tomorrow to put their roots down here and grow, so to speak, under the branches of the trees that you are today. So thank you for inspiring me across this spectrum from economic development to helping the residents of Salt Lake City to the public health benefits the world over. We now have a blueprint. We know what we're doing next, and we're thrilled to partner with you. Thank you for being here today, and I'll hand the mic over to someone. Max, thank you.
Good afternoon, everyone. My name is Max Backlund. I'm here representing the Gardner Policy Institute. We were honored when Mayor Mendenhall asked the Gardner Institute to help Salt Lake City create an economic development strategy around healthcare innovation. In addition to traditional economic development metrics, the Mayor asked us to consider human and social capital, including the perspective of the city's current and future workforce and the ability of its residents to succeed. Salt Lake City is the economic hub of the state, with over 300,000 jobs, 1 in every 5 jobs in Utah. The city's economy is large and diverse. This plan focuses the city's economic development efforts to capitalize on a strong economic foundation, including its existing healthcare innovation assets like the University of Utah, hospitals, businesses, and nonprofits. The city has one of the highest growth rates in life sciences employment in the country and one of the nation's highest concentrations of life sciences jobs. In Utah, the life sciences industry produces 8% of Utah's GDP and accounts for nearly 30,000 jobs in Salt Lake County. This blueprint was created using the informed decisions process. We formed a healthcare innovation advisory group that included 22 representatives of businesses, chambers of commerce, EDC Utah, industry associations, the University of Utah, Salt Lake City, including Councilmember Dan Dugan. The advisory group met 5 times between April of 2021 and July of 2021. And in addition, the draft blueprint was shared with a number of individuals and organizations for input and guidance. The group was tasked with identifying opportunities and challenges in the industry and providing recommendations to grow both the industry and economic opportunity in Salt Lake City. This blueprint has 4 pillars to guide tactical decisions for the city. First, grow and maintain the city's reputation as one of the top locations for healthcare innovation in the country. 2, increase investment, including industry partnerships, access to private capital, and targeted social impact investments. And 3, emphasize educational pathways and partnerships with employers. And lastly, strengthen the economic foundation and remove barriers for business growth. We offer our appreciation to Mayor Mendenhall for asking the Gardner Institute to assist with this plan, and to Council Chair Dugan, Ben Collender, Cahoon, and the team at Salt Lake City for their work throughout the process. We support Mayor Mendenhall's vision for increased economic opportunity in the city, and hope that our work leads to a brighter future for its residents. Thank you.
My name is Katelin Roberts. I'm the Executive Director of BioHive, the logo behind you. thank Mayor Mendenhall for releasing this ambitious blueprint, Q Factor for creating a vibrant place in our city, and the teams at Recursion and Denali for their incredible support of BioHive and their missions to improve patient lives. BioHive's mission is to brand, build, and bring together the life sciences and healthcare innovation ecosystems. Brand can be a somewhat corporate and lifeless word, so we prefer to tell our stories, because we all have stories to tell. Healthcare is the tie that binds us. Along life's journey, we can all take some bumps and bruises, or perhaps it's a close family member or friend. Maybe it's Alzheimer's disease or Huntington's disease. The progressive breakdown of cells in your brain is what happens with these diseases. You cease to be you. Those are the types of neurodegenerative diseases that Denali is working to solve. February 28th is Rare Disease Day. Imagine your child is diagnosed with a rare disease. Won't make it to adulthood because there's no available treatment. There's a chronic lack of funding in research for rare diseases. Not commercially viable. Doesn't make financial sense. We have other priorities. This is a reality for many Americans. Recursion is creating a map of biology, leveraging state-of-the-art science and technology to find new medicines, including rare diseases. They're working as fast as they can. This facility next door will manufacture new medicines for patients, and this blueprint will spur innovation in healthcare. This is a turning point for Salt Lake City. These are stories worth telling. But nothing can be done in a silo, and we are so fortunate to have leaders in government who care about the now and the future. I am so grateful to the group convened here who have guided BioHive and the aspects reflected in this blueprint that focus on diversity, equity, inclusion, STEM education, workforce development, and ensuring there are measurable goals for greater accessibility for underrepresented communities to educational pathways and economic mobility. Healthy communities, education, and economic resilience are priorities for BioHive. And as we experience growth and success in the city, I echo the mayor's comments. We are tasked with new and complex responsibilities that must ensure all residents who want to join us have access to this economic engine of opportunity. We look forward to the challenges and opportunities outlined in the blueprint, but let's celebrate our victories today and get back to work tomorrow. What we've accomplished is so exciting. This is a momentous occasion for our city, for the future of our community, and its residents with this blueprint release. It's also incredible for the companies, their employees, and the many patients who will be served by what is going to happen right here. Thank you for being a part of this journey and for caring about healthcare innovation. Together, we're going to do some great things.
It's a pleasure to be here today to celebrate the growth that we're seeing in Salt Lake City and right here at Industry. So, my name is Larson. I'm the President and Chief Operating Officer at Recursion, and Recursion is a proud founding member of the BioHive. And Katelin just told you a little bit about what we do at Recursion, and I'm going to tell you a little bit more. So Recursion is a clinical stage biotechnology company, and our mission is decoding biology to rapidly improve lives. And Recursion was founded right in Salt Lake City in 2013. We've been growing in Salt Lake City ever since. We have about 450 Recursion ops. Those are members of our team that are working just a few blocks away at our headquarters in the Gateway. And Recursion is a unique company because we work at the intersection of technology and life sciences, and we use sophisticated technology. If you at our headquarters, we've got robots, we've got artificial intelligence, we've got machine learning, CRISPR, a whole bunch of fun technologies. And the reason that we have those technologies is because we believe we can create better medicines using sophisticated technology and by unraveling the complexities of biology. We've applied those technologies to date to create what we believe to be the world's largest data set of human biology, and that data set, the size of it is over 13 petabytes and growing every day. So I'm sharing all of this with you just to highlight the fact that it is important to recursion that we operate at the intersection of technology and science, and that means there's no better place in the world for us to grow our company than right here in Salt Lake City. As you heard the mayor say, and others today, we have both a booming technology industry here, as well as a rapidly growing and emerging life science community, and both of these communities are required for us to successfully grow our company. One of the things that makes Salt Lake City such a unique place to be is this engagement and partnership that we see, and I can literally see it right here, between the private and public sector, and this involves our universities, our government leaders, our innovative companies, investors, and we all come together to build what we're building here. It's one reason it's so great to see Denali here today, contributing to the economy and the growth that we're seeing here. And I think they probably see what we see here, is that Salt Lake City is both an incredible place to live, and it's also an incredible place to innovate and to grow businesses. And so I really look forward to continuing our leadership in the healthcare economy and in innovation, and we're particularly thrilled to see the visible commitment that the mayor and others are making to supporting and growing our industry here in Salt Lake City. Thanks, everybody.
It's been a great opportunity to be here in Salt Lake City in the industry. And thank you, Mayor Mendenhall, for having us and being so welcoming. I feel a little bit like maybe the early pioneers when they came into the valley and they saw there was like nothing. And in reality, when we come here, there's a lot. But there's actually no one that's ever done biotherapeutics manufacturing in Salt Lake City. And so we kind of look around and look at some of my team members here, and you have to have that pioneering spirit, to start maybe from nothing and believe that you can build something. And we looked at many different places. I'm, by the way, Ryan Watson, the CEO and founder of Denali. We founded Denali in 2015, and it was basically founded in the Bay Area. I went to school, graduate school in the Bay Area, worked there for a number of years, worked at a biotech company known as Genentech, and then with Tina and others. And basically, and many of you that are here, and basically founded Denali in South San Francisco, in the Bay Area, where there was more than nothing. There was a huge ecosystem of biotech. But I had this desire that maybe someday, and actually it's very surreal for me to be here, that someday I could see that type of biotech sector here in Salt Lake City, having been born and raised in Utah. But let me tell you a little bit about what we do, similar to recursion. The way that I'll share with you what we do, it starts like this. After founding Denali to invent medicines for Alzheimer's, Parkinson's, ALS, about 6 months into the founding of the company, I actually relocated my family back to Utah so that they could finish high school, go on and do whatever they're going to do. And part of it was because my mother started to develop dementia, and we moved basically 1 street over from my parents' home so we could see them every week. And basically, one day after we had lived here for maybe, 3 months or so, my daughter, Abby, who happens to be here today, came home from school, this is here in Utah, and said, "Hey, do you guys work on ALS?" And this is my daughter in junior high school. And I said, "Well, yeah, we actually do." And she said, "Well, I have a good friend whose father has ALS." And I'm like, "Really? It's very uncommon. It's a pretty rare disease." And that sort of began probably one of my closest friendship, and actually the hiring of our first really Denalian here in Utah, and Seth Christensen, who's here with me today. So Seth, I met Seth in 2016, right after we moved here. And Seth, you've been the only person, the only Denalian in Utah until we hired me, I guess, 6 And so Seth joined us actually in 2018, right after we went public as a fellow. And basically what I get to do is have one-on-ones with Seth. I wish it was every week, it's about every other week. And usually there's some major topic, and the topic that we covered in the last month is time, and how important time is. And Seth is an outlier. He was diagnosed with ALS 11 years ago. ALS, the average lifespan is between 2 to 5 years in fact. And so Seth has been able to see some of his children grow up. We've been able to be part of that. And now Seth is, however long, since 2016 till today, we're now building Denali here, and time matters. And so some of our friends from Q Factor, this is such an extraordinary building. Now you know why I obsess about time. Because time in our patients' lives, really every day matters, what we get to experience as a patient. And we're going to do something that hasn't ever been done in Utah, that we're going to make medicines. We're actually going to manufacture them in this building to try to give time back. That's the ultimate goal. And so this healthcare initiative for Salt Lake City, you're picking the right industry, Mayor Mendenhall. There isn't a better industry. We see the power of medicines. We see what has been done with vaccines. We've seen what's been done with incredible cancer medicines for some of the companies we've worked in previously. It literally gives back time, extends people's lives, increases their quality of lives, and it focuses on an industry of how do we really improve people and their interactions and ultimately their health span. And with that, we're so grateful to be welcome here. Denali, those are with me. We have a small team that's here today, some of which are Bay Area based and flew in for this event. And we're so grateful to be here. Q Factor, I can't imagine a more extraordinary, beautiful building. We like our building in the Bay Area, but this is way better. Don't tell me. Is this recorded? Don't play this back. Those Denalis that are here, it's going to be over 100 individuals are going to be working here and manufacturing medicines. They're going to be lucky to be living in Salt Lake, working here in this incredible building. And I think with that, I'm going to hand it back to Clark. Thank you.
Thank you for being here. As I look out, I see developers, people that are making the space that we need to see this industry grow. I see people that are focused on incubators and kind of coddling and helping along the innovators and the founders of companies. I see people that have IPO, I see investors, I see government people, I see educators. It's really inspiring to see everyone come together. I don't think we look at this as a bit of an inflection point. This is more than just a blueprint. It's more than a message and kind of coming together under one banner. It's more than a really cool space. It's really impressive to see everyone in the community come together and work on something that's larger than just us. And I love this industry. I love where things are going in the city with this industry. It's really fun to be a part of it, to all of you. Thanks for being here. Real quickly before we adjourn, just want to acknowledge city council members that are here. Really appreciate their support. And also the advisory board members that helped put together this blueprint. You're in the audience, and we really appreciate the effort and the time you spend to help shape this policy and the work that we're doing.